Thank you and good afternoon. So my name is Julie Jaffray. I'm at the Children's Hospital of Los Angeles. For the next few minutes, I'm going to talk to you about how we have determined the incidence, and we're looking at the risk factors for central venous catheter-associated thrombosis in children. This study by Leslie Ruffini, published in 2009 in Pediatrics, looks at rates of hospital-acquired VTE in children over a 7-year period. And what they noticed, that it didn't matter what age the child was, this rate of VTE went up dramatically by 70%. We also noted that these children who got the VTE in this study had increased mortality as well as increased hospital stay. So why do we think there is this increased VTE rate in our kids? Well, we're doing a better job taking care of our really sick kids, and they're living longer, but that makes them at risk for a VTE. We're also looking at them more. We're thinking about VTE more. Our detection methods are better. But the biggest reason is we're increasing our use of central venous catheters in children. So I created this study to actually look at the incidence and the risk factors for central venous lines in our kids, called CIRCLE study. So it's prospective, it's observational, and it's multi-center of 4 children's hospitals across the US. So our aim is to look at both the incidence as well as different risk factors for our children when they get 2 different types of line placed. One are peripherally inserted central catheters, the other are tunneled lines. Now I know I'm in the press, so I wanted to help you guys understand what that means. So the tunneled lines are placed centrally, tunneled under the skin by the clavicle. There are different types. There's single lumens, there's double lumens, and then there's an implanted portacath. Versus the PICCs, which are peripherally inserted here in the arm, and then they go up the arm, and they also end centrally like the tunneled line. So what we did is we took children 6 months to less than 18 years who had a newly placed line. Now this study is still ongoing. I'm going to be presenting preliminary results. So we then, once the child got the line placed, followed them through their medical record, looking at things like age, different demographics, how the line was placed, what type, what vein was used, was ultrasound used. And then we would check periodically to see if they got an infection or a blood clot. Just to let you know, we did not screen. So some studies will actually look for VTEs in their patients regardless of symptoms. We did not do that in this study. So we have an update from what's in the abstract. We now have 1,200 1,200 CVCs, about 1,100 subjects that are reported in the results that I'll be talking about more tomorrow. 1/3 are from tunnel lines, 2/3 are PICCs. What we found was the combined incidence of all CVCs, the rate of VTE was 5.7%. But when we separated those 2 different types of lines, you can see this dramatic difference. The PICCs had an incidence of 7.5% of VTE versus the tunneled lines, which were only 2%. And we noted 85% of our VTEs were in patients who had PICCs. We also look at an infection. How often did these central lines give the patient infection? We call this a CLABSI, central line associated bloodstream infection. Overall, it was 12%. When we separated, quite the opposite. The tunneled lines had 16% versus the PICCs that were 9%. So we also noted a few other things that showed an increased risk of VTE with this preliminary results. One, patients with cancer, especially leukemia, congenital heart disease, and those with multi-lumen CVCs. So the next step, we're going to continue to enroll subjects. We're going to hopefully create guidelines once we hit our 2,000 subjects that we're hoping to have in there to determine what type of central line, what patients to put each type of central line, and if some people require anticoagulation prophylactically. So in summary, there's an increased rate of VTE in our kids. There's significantly higher rates in those with PICCs, those with cancer or congenital heart disease, those with multi-lumen CVCs, and we noticed tunneled lines had an increased rate of infection versus PICCs. And these are my colleagues and group, and thank you.